A healthy psychologist reported hearing 3 words: empty, hollow, and thud, and was admitted to a psychiatric hospital with schizophrenia. Then he stopped pretending. If normal behavior could not free him, what could? The voice vanished. He behaved normally. But when David Rosenhan finally left, the hospital did not declare him sane. His schizophrenia was recorded as in remission. That trap made Rosenhan's experiment famous. Then investigators found a second trap. The story that taught millions to distrust psychiatric certainty might not deserve certainty either. In 1973, Rosenhan reported sending 8 healthy people into 12 psychiatric hospitals across 5 states. Some entered more than once. They used false names, and mental health professionals hid their occupations. Apart from the invented voice, Rosenhan said they told the truth about their lives. The moment each was admitted, the performance ended. They told staff the voice was gone. They spoke normally. They followed instructions. They tried to convince staff they were well enough to leave. Rosenhan had warned them of one thing. Once inside, they would have to get out by their own devices. Almost immediately, all but one wanted out. Yet normal behavior did not erase the diagnosis. It was pulled inside it. One pseudo-patient wrote openly in the day room. Rosenhan later quoted a nursing note. Patient engages in writing behavior. Another paced a corridor. A nurse asked, "Nervous, Mr. X?" "No," he replied. "Bored." A group waited early outside the cafeteria because there was little else to anticipate. A psychiatrist used the scene to teach residents about a supposed psychological syndrome. The hospital did not merely observe behavior. In Rosenhan's telling, it supplied the meaning. This does not prove doctors should have ignored reported hallucinations. They were serious symptoms, deliberately fabricated. Clinicians cannot test whether a voice exists with a blood sample. The sharper question came after admission. What evidence could ever reverse the first judgment? Rosenhan reported stays lasting from 7 to 52 days. The average was 19. Nobody on staff identified a pseudo-patient as sane. 11 admissions ended with schizophrenia, in remission. 1 with manic depressive psychosis, in remission. The diagnosis bent. It did not break. But people elsewhere on the ward sometimes saw through the disguise. "You're not crazy," one patient reportedly said. "You're a journalist or a professor. You're checking up on the hospital." Across 3 admissions wards, Rosenhan counted 35 patients who voiced that suspicion. The people officially judged unreliable were sometimes quicker to question the official story. Then a teaching hospital challenged Rosenhan. Its staff had heard his results and insisted they would catch any imposter. Rosenhan told them 1 or more pseudo-patients might arrive during the next 3 months. Now every admission carried a second possibility: patient or plant. Staff assessed 193 people. 41 were judged highly likely to be pseudo-patients by at least one staff member. 23 were suspected by a psychiatrist. Then Rosenhan revealed how many imposters he had sent. None. Expectation had apparently worked in both directions. When staff expected illness, Rosenhan said they found illness in healthy people. When they expected deception, they found imposters among genuine patients. It was an unforgettable result. It was also where the clean version of the story should end. Psychiatrist Robert Spitzer attacked the design soon after publication. The volunteers had lied about hallucinations. Failing to detect a convincing lie, he argued, was not the same as failing to diagnose an honest patient. Rosenhan had demonstrated that clinicians could be deceived, then attached a larger conclusion to it. The objection was serious. The legend survived it. On Being Sane in Insane Places became a classroom classic during a wider revolt against psychiatric institutions and unreliable diagnosis. Its structure was perfect. 8 healthy people, arrogant hospitals, one devastating reversal. Decades later, journalist Susannah Cahalan tried to rebuild the study from records rather than legend. She searched Rosenhan's archive, medical files and participant trails. The 8 clean cases would not reappear cleanly. Records conflicted. Much of the participant roster resisted verification. Harry Lando, one participant Cahalan traced, described a more positive hospital experience. Rosenhan excluded his data officially because Lando had not followed the method correctly. That exclusion mattered. The famous paper claimed different hospitals produced the same pattern. A participant who remembered humane treatment complicated that pattern. Cahalan's investigation raised the possibility of selective reporting, distortion or invention. In 2023, historian Andrew Scull used her findings and records she shared to make the harshest charge. He called Rosenhan's research a spectacularly successful case of scientific fraud. That is Scull's conclusion, not a neutral label. But the underlying problem cannot be edited away. Rosenhan's 8 cases are not 8 independently verified case files. So what survives? Not a verdict against diagnosis. The volunteers reported symptoms they did not have. Not a verdict against every psychiatric hospital, then or now. What survives is one warning. Once authority accepts a label, later evidence can be forced to fit it. Rosenhan reported that normal behavior could not erase schizophrenia. For decades, missing records could not erase classic experiment. Doctors may have been fooled by fabricated symptoms. Textbooks may have been fooled by a perfect story. Real patients carried the cost of both. Institutions that could strip them of credibility, and evidence too unstable to prove everything claimed in their name. The final question is not who was sane. It is what evidence would authority have accepted as proof it was wrong. Next, the interrogation method built to make a suspect accept the story authorities already believe.